11 early symptoms of pregnancy in first trimester. If you suspect you are pregnant, you may experience a range of symptoms or none at all. It is important to know that everyone is different and may not experience the same symptoms. It's also possible to experience different symptoms from one pregnancy to the next. A pregnancy is divided into trimesters. The first trimester is from week 1 to the end of week 12. The second trimester is from week 13 to the end of week 26. The third trimester is from week 27 to the end of the pregnancy. Symptoms of an early pregnancy can be confused with premenstrual syndrome symptoms, and some women don't notice they're pregnant until more advanced stages. The most accurate ways to diagnose pregnancy are through pregnancy tests or uterine or abdominal ultrasounds. However, the following signs and symptoms are considered very common in the early stages of pregnancy, despite not being specific to pregnancy. 1. Cramping and spotting. These symptoms are more common between the first and fourth week after conception, and are medically called implantation bleeding, when the fertilized egg travels to the uterus and attaches itself to the endometrium, layer of tissue in the womb. In a process called implantation, you may feel cramps and have mild bleeding, spotting, as the cramps occur at the same time as the spotting. This is often confused with menstruation. However, the quantity of blood is a lot less than a normal period. 2. Missed period. Missing a period is considered the most obvious and early symptom of pregnancy because it can be noticed from the fourth week after conception. In fact, many women take a pregnancy test because they have missed their period. However, there are many reasons why a woman may miss a period, such as hormonal imbalances, losing or gaining too much weight, stress and severe fatigue. 3. Fatigue. Feeling tired and fatigued are common symptoms of pregnancy, and typically occur in the fourth and fifth week. However, it is possible to feel unusually fatigued in first week after conception. This symptom is mainly due to a high level of the hormone progesterone, but also may be as a result of low levels of blood sugar. The best way to overcome this symptom is by getting plenty of rest and eating meals rich in proteins and iron. 4. Nausea. Known as morning sickness, feelings of nausea usually appears between the fourth and sixth week of pregnancy. Although it is very common, not everyone experiences it. Experts say that this symptom can appear due to the increase of pregnancy hormones, but the specific cause is not completely clear. It's called morning sickness, as it's more common in the morning. However, it can occur at all times of the day. In some women, nausea and vomiting are caused by certain foods and smells, which is also related to hormonal changes. Some women experience nausea, cravings, and food aversions during pregnancy, but fortunately these symptoms tend to disappear after the 13th or 14th week. 5. Breast changes. Changes in the breasts usually appear between the fourth and sixth week, and they appear due to hormonal changes. The most common changes in the breasts are tingling, aching and swelling. As pregnancy progresses, the breasts become fuller and can be more sensitive to touch. 6. Frequent urination. Symptoms of needing to urinate frequently usually appear between the fourth and eighth week and then again in later pregnancy. This is due to the uterus becoming larger, and it presses against the bladder, increasing the need to urinate. Likewise, hormone levels also increase the urination frequency. In some cases, it may indicate a urinary tract infection, which is a frequent condition in pregnant women, but one that may need to be treated by a doctor. If you experience pain while urinating, it is important to see a doctor. 7. Constipation. High levels of the hormone progesterone can slow the passage of food through the intestines and can cause constipation in pregnant women, a symptom commonly experienced between the fourth and eighth week of pregnancy. Experts recommend drinking plenty of water, eating plenty of high-fiber foods and exercising to relieve constipation symptoms. If you feel that the constipation is so severe that you need medication, it's important to consult a doctor to determine which stool softeners or laxatives you can take without harming the baby. 8. Bloating. Between the fourth and sixth week you may also experience bloating, again caused by increased levels of the hormone progesterone, which slows down the digestive system. Some women also refer heartburn, medically known as pyrosis, which is a burning sensation that you feel in the middle of the chest behind the esophagus and the upper abdomen. This symptom usually appears between the fifth and sixth week of pregnancy. because of the hormonal changes occurring in the body. You may feel faint, dizziness or vertigo when changing from one position to another quickly. Experts say that getting up slowly and lying on your side can help to ease these symptoms during pregnancy. 9. Mood swings. Changes in mood and feeling more emotional than usual can be caused by hormonal changes, especially in the first 3 months of pregnancy. Fluctuating progesterone and estrogen levels can have an effect on mood during pregnancy, and during this time it's common for your mood to change quickly, or ups and downs to be triggered by situations that wouldn't usually cause these reactions. 10. Temperature changes. In the 6th week of pregnancy, you may experience changes in body temperature due to the hormonal changes, going from hot to cold to hot again with no apparent reason. And finally, it is advisable to always see a specialist to correctly determine whether you're pregnant or not. If you are pregnant, your doctor can help to accurately find out the due date and advise on a healthy lifestyle to help you through pregnancy.